this article that's in Nature is saying that the rise of digital health technologies for biometric data and health insights, so wearables that are tracking you, can lead to fatigue, anxiety, information overload, which means that your engagement with them reduces and actually you can get worse health outcomes. But what this article has done really interestingly, it has then gone on to discuss the role of AI assistants that are a new layer in between all your wearables and you hearing what they're saying. So instead of you seeing the signal of your heart trace on your Alive Core, you no longer see that. All you see is what the AI assistant has deduced and told you. So it's far more actionable in terms of insight. But just to go through some of the things specifically that this paper says, it says that whilst the tools are obviously valuable from generating all of this biometric data, medical insights, etc., not only is it fatigue, anxiety, information overload, that's then an increase in cognitive and emotional burden. And it's that cognitive load and emotional burden that means that you're less likely to engage in your own healthcare and then potentially compromise your health outcomes. Another term that it talks about in this article is cyberchondria, which I've actually never heard. Yeah, I've never heard it, but love it because I have friends that have I don't want to be loose with the term health anxiety because I think there are people with very legitimate and debilitating health anxiety, but they are on a spectrum of it, let's say, that it burdens them. It burdens them worrying about their health. And I mean, I'm in that dangerous category of having gone to medical school and then not really practiced that much as a doctor. So I've got too much information that I'm anxious about a lot of things whenever I have the vaguest of symptoms. But yeah, cyberchondria has emerged, which refers to health anxiety fueled by excessive digital self-tracking. You can misinterpret normal physiological fluctuations and you get this emergence of maladaptive tracking behaviors that transform well-intentioned health management into rigid, distressing preoccupations with metrics and targets. And obviously quoting directly from the paper here, this I see this colloquially, anecdotally with my friends all the time. They're more interested in the metrics than they are about the life that they can have outside of it. And it looks exhausting. I mean, I hate the trackers. I don't use them personally. I can see the medical benefits and all the rest of it from a health tech perspective. I get it. And when if I had heart failure, I'd want to be checking lots of stuff all the time because then it has direct purpose to it. But I see this in the fit and the well all the time anyway. There's a nice figure in this article where it says a good example is people that wear Fitbits, Apple Watches, Alive Core, like stuff like that will see a heart trace. Instead of then seeing the heart trace and the literal activity from your tracker, the AI layer would then read that and it would say to you, your resting heart rate improved 5% this week. That's actually all you need to know. That's the actionable bit that then can insulate people from the actual heart trace, the risk of misinterpretation and all the rest of it. And they talk in this article as well about how that mirrors actual healthcare as well, because as clinicians that have been raised in a value-based healthcare system, which is what UK NHS trained doctors are. We're raised in a value-based healthcare system rather than a fee-for-service healthcare system, which is more like the US. Value-based healthcare is all about not over-investigating. And that feels comfortable for us. And that's why this feels comfortable for me, because then you're not arming the public with all this data that they can't interpret. And that's not me being high and mighty as, oh, I can interpret it and you can't. It's just that you cannot interpret 24 hours of a heart rate trace. Like, I can't do that. A cardiologist can't do that every 24 hours. So you feel like there's so much, and that's just your heart rate. There's all these different traces all the time. And yeah, it mirrors healthcare. You would not be taking all of that data to your GP and go, please analyze it, unless there was a problem that needed analyzing. So what I like is that the promise of these AI health companions is to help. I imagine there's always going to be people that love the quantified self to the level of wanting all of those traces, but this feels very much like a maturing of the tracking space. It feels almost reasonable that I would get one of these again. My Fitbit famously went in the bin after 12 hours after it told me I had a rubbish night's sleep. And I'm there like, try and sleep harder. I need to impress the Fitbit. And then I was like, this is absolutely ridiculous. I think if everyone was to come into the wearable world with post the AI layer and knowing, and that was their expectation was that they were only going to get actionable advice. My hypothesis is that everyone would be happier, but that's obviously a bias because I don't love the quantified self, but I'm talking to someone who does love the quantified self. So I don't know what your counter opinion to that would be.